Good morning, good afternoon, good evening, wherever you are on our beautiful planet. Welcome to new members of our community, and nice to see some familiar faces again. As we do at the start of every one of these webinars, we read our agreement to how we want to come together as a group, as a community here. So it's just a few sentences. These community webinars are here to support our members and mission of spiritual integrity. We ask participants to stay connected, accountable, sensitive, and skillful when we engage today. We ask that you agree to create and maintain safe space for learning and growth. To that end, we will all refrain from marketing or self-aggrandizing while avoiding inflammatory or deliberately destructive comments. If you want to recommend a relevant and appropriate resource to attendees, please do so in the chat box. The ASI will remove participants who engage in harmful activity after one warning. Thank you so much for creating this community with us, showing up with presence, attunement, and self-awareness. I'm now going to hand you over to Phil, who will launch and introduce today's webinar.
Hi, everybody. Those of you who were with us at the last webinar, remember that we discussed the issues around entheogens or psychedelics, and we were just getting rolling on the ethical issues around it when we had to stop. So we decided to have another go at it, and this time invite some real experts to lead the discussion. We were scheduled to have two of them, both happen to be old friends of mine, but Dana Sawyer is in Spain and has a minor illness and can't join us. So Rachel Harris is going to carry the load, of which she's most capable. Rachel is a clinical psychologist. She was in private practice for what, Rachel, 100 years or so?
Yeah, pretty much.
And also spent years as an academic researcher and published more than 40 peer-reviewed studies. And in recent years has turned her attention to the use of entheogens in spiritual and therapeutic contexts. And she's written about that in her last two books, Listening to Ayahuasca, and the second and most recent, Swimming in the Sacred, Wisdom from the Psychedelic Underground. She was kind enough to send me some links to other resources that she recommends on these topics, so I will put them in the chat box as we go along. Rachel, thanks for taking the time for us today.
Oh, my pleasure, Phil, of course. And I was just telling Jack that there are beginnings of organizations within the psychological community, within the psychedelic community, that are being concerned with ethics and right action. And I've sent them your code of ethics, which I think is wonderful, to kind of help them along the way. They've been totally ineffective so far, but your code of ethics, I think, is a wonderful start. But I first want to just acknowledge Dana. We've talked about this presentation, had emails back and forth. And one of the articles, Phil, that I sent you is called to disperse or link is The Revolution Will Not Be Psychologized. So in a commitment to transparency, I've spent my life psychologizing. So I have a bias. But let me just quote Dana in a recent email. The most enlightened ethical question is the limits the limits of psychotherapeutic individualist bias. So that's me. So you're getting, as much as I will try to give a broader view, I want to be transparent about that. That is my bias. And Dana would have presented a different perspective on that. we'll just try and keep that in context. So I have slides. And I want to say, listen, you can interrupt me anytime. We can go off on tangents. Whatever you want to do is fine with me. And then, of course, we'll have discussion and questions at the, after the slides, but I can be interrupted anywhere along the way. So, Chris-Anne, we have slides. So let me acknowledge the artist here. This is a close-up of a painting by an Australian Aboriginal artist. And the art in Australia is controlled by the government to protect the artist. So I bought this through an art gallery that works with the Australian government to protect the Indigenous artists. And I bought it when I was working on the ayahuasca book, because to me, it felt like this is a painting of the Pleiades. And to me, it really was a very close association to what you see under the influence of ayahuasca. So to me, it seemed very related, and I bought it for inspiration when I was working on that book. Okay, the next slide. So Dana and I kind of went over what's the range of issues, and these are overlapping, and I won't go into each of them far, but they'll come up. These are the themes, and is that there's a tremendous power imbalance in psychedelic-assisted psychotherapy, which is now that's referred to as PAP, PAP, psychedelic-assisted psychotherapy. And that power imbalance is partly because of someone under the influence is enormously suggestible. And that leads to an increased vulnerability in that relationship. And so you can see the interaction of those first three issues. And then informed consent is a major issue, because you attain, as a researcher, you get informed consent before the medicine is given. But once the person is in a psychedelic state, they're in a different consciousness than when they gave informed consent. So here's how, from my own personal experience, here's how that looked. I signed up for a ketamine session because I'd never experienced it. And this was in writing the Swimming for the Sacred book. And I thought, as a researcher, I have to sacrifice myself and take ketamine. So I was with a therapist and a doctor. And, they asked me about how did I want to be touched? And I said, nothing, don't bug me, basically, don't touch me. As soon as I went under the influence, they took my hand and they just held my hand. Now, that was not what I asked for, but I so appreciated it. And there you find the difficulty in informed consent. I felt like they were holding the string to me as a balloon. They, that I had a way to get back to this world. I was so grateful that they held my hand, and they held it in a way. I mean, this sounds crazy to talk about hand holding like this, but trust me, it was very important. So if one of them, this went on for 4 or 5 hours. So if one of them went to the bathroom, they just switched hands and they did it seamlessly. I was so appreciative. It was really quite a beautiful part of that. But you can see that my informed consent was the opposite. I was what in psychology we call counter-dependent. No, I don't need help. I'm fine. But I did need help. So that's really a big issue. And then one of the articles that I've sent talks about, well, you can gain informed consent during the journey. Well, no, you can't, because God knows what we say during a psychedelic journey. That's not really an informed. You can't give that's not a real informed. You can't give an informed consent when you're in an altered state. It's like asking someone if they're drunk, do you want to XYZ? They can't give an informed consent. So this is an insolvable problem. And there are a number of insolvable problems that we face with the use of psychedelic medicines and research and getting research approved. there are real problems, as you could see with what happened with the FDA on MAPS's application for MDMA. And then, medical screening in research studies, that's done very well. But one of the articles I gave you talks about, here's the quote, non-clinical use, it's a nice way of saying underground, is the vast majority. And I do a lot of interviewing at conferences and meeting people. And I remember talking to this one underground practitioner in her mid-20s, maybe, lovely young woman. And I said, how do you do the medical screening? And she said, what's medical screening? So if non-clinical use underground is the vast majority of the use of these entheogens, what kind of medical screening is happening? And then this overlaps with a lack of acknowledging adverse effects and risks. And there's a Substack that Jules Evans is the one who's writing most about adverse effects. And they're not really acknowledged in the media or in much of even the professional writing. And then, of course, the problem that the whole society has about how to be more culturally inclusive and responsive to need, and the the going rate for an underground journey can be between $2,000 and $5,000. And that's not available to many people. That's one night, that's one journey. So this is a problem that the psychedelic renaissance is facing. And I'm sure, there are other issues. I mean, the one that I talk about with my own personal that I'm upset about almost the most is when I was in a research office. I served 10 years in a research office, and I was trained. I went in knowing nothing, and I came out with an NIH grant. I was told when you develop a research protocol, you talk to people who are experts in that field, which is exactly what you're doing, by the way, right now. But the research teams did not do that, because they should have called in the people who have been working underground for 30, 40 years. That's an enormous amount of experience. And they could have really enriched the kinds of questions that the researchers ask. And because I know a lot of those underground practitioners, I interviewed them for the Swimming in the Sacred book. I know they could have, the research teams could have reached them. They're not so underground that they're not reachable, but they did not do it. And here's the way that manifested in a research study out of Hopkins. And that is that they did an internet survey. This is sort of how, this is kind of the mechanics of research and how you can make mistakes. An internet survey. So they had like 5,000 subjects, because you get lots. And the question was, did you encounter an entity during a journey? So they divided people, because they had so many subjects, they divided them into what was the drug, what was the influence they were under. So they had, ayahuasca, LSD, I forget the range, but they had like 6 different options. And the question was, did you encounter an entity? And so what percentages of people said yes? But that was the wrong question. And if they had asked the underground practitioners who'd been working for decades, the correct question that I was told to ask when I did a research study in, I think I started it in 08 or 09, and it was published in 2012. I asked, do you have an ongoing relationship with grandmother ayahuasca, with the spirit of ayahuasca? Do you have an ongoing relationship with the spirit of ayahuasca, was the research question. And I only asked it because I had interviewed an underground practitioner who'd been working at that time for 30 years. And I gave her my research, my questionnaire, the protocol, and said, have I asked all the right questions? What did I miss? And she said, ask this question. And I said, thank you. And I put it right in the questionnaire. And 70% of my subjects, I had 81 subjects who filled out a 16-page questionnaire, and many of whom I interviewed personally, 70% said they had an ongoing relationship with the spirit of ayahuasca. Now, if you ask, did you encounter an entity? You don't get that ongoing relationship. And what does that mean, an ongoing relationship? What does it mean in terms of your understanding of reality, ontology, what it means to you, how therapeutic is it? And so this has not, you know, the major research studies coming out of the academic medical schools and departments have not asked this question. And this is it's a foundation of indigenous use of a good number of these medicines, certainly ayahuasca, which I know the best. And it's a different worldview. And that's why it's not asked. I mean, that's another aspect of why it's not asked. And the article that's just out January this year, 2025, is 4 pages. And I would say if you read anything, read this one. It's an opinion statement. And the title is Healing Harms and Humility. And they're really asking for humility from the researchers to consider other voices, indigenous voices, underground practitioner voices, to have a bigger perspective, a larger worldview, and to acknowledge humility is a key. They talk about epistemic humility is not merely an acknowledgement that one's knowledge base is constrained. And that's how I started this. My knowledge base, I'm biased. So there, and humility is a big factor in training shamans, because it is really the dividing line in shamanic training between becoming a sorcerer who misuses power, which we see a lot of, we know what that means, and healing, someone who helps people. Or as one of the shamans said to me in a Zoom video with a translator, he said, the plants want to help you. That's a healer. The plants want to help you. It's not me, it's the plants. That's a very important statement. And that's just somehow missing in the research. So culturally inclusive and responsive has different levels of meaning. So I just gave you some of my own biases and upset about some of what's going on. So let's go to the next slide. So these are quotes from the book is The Secret Chief. And so let me get my notes because I don't have a memory anymore. These are quotes from Leo Zeff, who was a San Francisco psychologist who retired around 1960, and then he discovered psychedelics and he opened his practice again, working only with the entheogens. And so he trained a lot of people in the San Francisco Bay Area. And excuse me, The Secret Chief is available online. It's an interview book. It's a short book, but you can get it for free through MAPS. So that's the title, and maps.org. You can, if you go through there, you can get it for free. So these are the first one is a special, I think these are all his quotes. And it's part of the contract that the underground practitioners have used for 40 years or so, actually longer now. And you can see that from the very beginning, they acknowledge there's an issue around crossing boundaries. So Leo Zeff was very clear, no sex, absolutely no sex. And I have a couple of other quotes of his. And I met with a good, solid New York therapist who I'm supportive of a number of people who I know are doing really good work. And she said, every time she does a journey with someone, she reads through this book, The Secret Chief, because it's very inspirational about how to work with these medicines. So, and of course, confidentiality is to protect the client and to protect the practitioner, because they certainly in years past were at risk for prison sentences, and could be the same now, but we don't know, but they are at risk. Okay, next slide. And this was this is one of Jeremy Narby's books, where he says these medicines should have a warning on them that what you believe going in will be altered, will be changed. You will lose your beliefs. You will lose your worldview, your belief system, your sense of reality. And this is, I mean, how do we get an informed consent for ontological shock, that the whole world looks different, and a person's sense of reality is forever changed? And there's not enough talk about this. Or I shouldn't say it that way. There's a lot of talk about this in a positive direction. So like one of the quotes from one of the NYU subjects who was in a study for terminal cancer patients, it's done in New York. She says, I'm a lifelong atheist, but after this psilocybin journey, I could only say I was rocked in the arms of God, but I'm still an atheist. I mean, this is really a New York statement, but that's an ontological shock. I mean, it's her sense of her belief system is no longer fitting congruently, but it doesn't seem to matter to her. But did she give informed consent to have her belief system altered like that? So you see the problems really range. Okay, next slide. So here's the most common ethical issue, and this is from psychotherapy research. So I just printed this out. Ken Pope did the most research on boundary crossing. Boundary crossing is a euphemism for sex between the therapist and patient. So and so this is a chapter actually by that title, Sex Between Therapists and Clients. And it was published in 2001. And it's this is sort of a summary of the research and what he came. And so the research is based on questionnaires sent to licensed therapists who are willing to admit in an anonymous questionnaire that they had sex with a client. So it doesn't include the therapists who were not willing to admit that they had sex with a client. So these are underestimations. 7% of male therapists and 1.5% of female therapists admitted they had sex with a client. This is from data from national studies that are pooled. So it's a meta study. So, I gave a talk to therapists on Australia after they had successfully lobbied the government to make MDMA legal by prescription. And, I gave an hour talk or so on ethics, and basically the summary is don't have sex with your clients. And of course, that's totally ineffective. There will be plenty of sexual abuse, and there already is. And that's the article called Wolves Among Sheep. And I've never seen this in a professional journal. Wolves Among Sheep, Sexual Violations in Psychedelic-Assisted Therapy. It's the American Journal of Bioethics, and they name names. That's what I have never seen in a professional journal. They name names and describe the situations. And I think that's incredibly necessary. And that's one of the risks. And here's the other thing I put in this, that the male therapists, when they looked at the ages of the therapist and the patient, the women were 10 years younger. So there's a pattern here. That's pretty consistent. Okay, next slide. And this is again from Leo Zeff, and he basically is saying, of course the therapist will have thoughts about sex. It's guaranteed. Sex, the thoughts will come up. And so the safety railing is peer supervision. And many underground therapists practice in isolated ways, and they don't have peer supervision or consultation. They don't have therapists to refer to. They are not in therapy themselves. So it's just the nature of psychedelics to open up, for many people, thoughts about sex in both the person sitting or the therapist and the client. This is true in the intimacy of just even regular psychotherapy. And it's peer supervision that will help with that. That is the best guardrail we have. And so I've said to people, if you work with one of the elders, the underground elders, they look like they're practicing alone, but they are not. They have expert advice that they can call immediately from therapists or from pharmacists, or physicians to ask about medical questions and screening. They will meet sometimes in a group or just for lunch or for retreats together. They are not really practicing alone, even though they look like it. But many of the new underground practitioners are alone, and they don't have access to this kind of experienced expertise. And they don't even know to ask. Let me just say that. Okay, next slide. So this is a photo from the Hopkins study. And one of the questions that comes up in the field is of psychedelic research is, does the therapist have to have their own entheogenic experience? And I come out, my position is absolutely, and more is better. As much experience as possible. And the underground practitioners who I interviewed, the elders, they had a lot of rules. And one of the rules was, you don't give an entheogen that you have not personally experienced. And that means even that batch of ayahuasca, you have to drink before you serve it. So I did an interview with an ayahuasca practitioner who is not, I want to clarify this. She was supervised by indigenous shamans, but did not do an extended apprenticeship, but worked with shamans for many, many years. And I interviewed her. It got to be dusk. I was leaving, and she pulled out, a thermos bottle and said, well, now I'm going to drink ayahuasca. And I said, why? I was just leaving her. She was all alone. She said, because I'm doing ceremonies this weekend. I'm going to serve it tomorrow night. And I have to experience this batch. Every batch is different. So she was going to spend that night in her own ceremony, testing really the batch of ayahuasca that she had. And I, of course, got out of there as fast as I could. But that's one of the rules. I mean, there just are these rules that not everybody knows about. And in fact, this is a story from years ago from one of the underground elders. She said that when she was younger, she made a mistake and served, I think it was a combination of drugs that she herself had not experienced. And the peer groups and supervisors that she was working with, the ruling was she couldn't serve any medicine for a year because she broke that rule, and she followed that guideline. That's how strong the rules were, and that's how strong the peer supervision was. So when I give talks, I'm in the awkward position of saying to licensed therapists, you should have as much entheogenic illegal drug experience as you can get. So I'm encouraging illegal behavior, but that is my belief, that that if you're going to sit with someone, you really have to know the territory, and there's no other way to learn it. So all these training programs that are on the internet, you can get a lot of information, you can read a lot of things, but it's really out of your own experience. So this will come up in other ways again. Go to the next slide. I don't hear anyone else talking about this, and it's something that concerns me. And that is that the psychotherapy role is for integration, but the guide is the one who sits there. These are two different roles with two different kinds of expertise. One needs to be licensed. The psychotherapist should be licensed. The guide doesn't need to be a licensed therapist. But this was really separate years ago, but now it's totally conflated. And so it's very confusing to me. So there are psychotherapists sitting, and then how much therapy are they doing? Is somebody silent the whole time? I mean, when I did ketamine, for instance, it was at a ketamine therapy clinic. I had a doctor and a therapist there. I didn't say anything to them the whole time. So it's not a therapy session. They didn't need to, I mean, legally I needed to have a medical doctor there, but it was not a therapy session. They were sitters for me. The doctor made the decision about the dosage level, and she was very astute, but it was not a therapy session. So these roles, these situations are conflated, and it's very confusing. And in Europe, in the States, we do psychedelic. We've had psychedelic therapy historically. In Europe, they do psycholytic therapy, which are much smaller doses, where the patient can be able to sit up and talk. And so the entheogen opens them up so that they can do more work in a therapeutic relationship. So those people are not sitters, they are therapists working with a client. But that's a much lower dose, and it's embedded in a process of therapy. So they might do a psychedelic session once a month, and then the other 3 weeks of that month, they do regular therapy. And ketamine clinics are working in all different ways. Some of them do high doses, at the start, 2 or 3 times a week to kind of break the person out of their depression. But other ketamine therapy does smaller doses over time. So, and you do know some people are getting ketamine dosages through the mail. So this is a wild territory with very few rules these days. So I know one ketamine therapist, and she works with a company that mails the ketamine lozenges to patients. And she had a client who had a month's supply of ketamine, which he took one day, and then called her because he felt terrible. And she said, you have to go to an ER, you have to go to an emergency room. But he took it all at one time because he wanted the therapy to move faster. So you can see the possibilities of all kinds of abuse. The other thing that it comes up for me with this situation that's sort of shocking to me is there's a huge increase in the number of people taking entheogens home alone. No therapist, no guide. Maybe they have someone they can call. Maybe the wife is or the partner is upstairs and they're in the studio in the basement. Some people are totally alone, and they're even drinking ayahuasca alone, which is just kind of terrifying to me. And it eliminates the essential role of the shaman. I mean, it's an ignorance of how the indigenous healing works to not be with a trained shaman. So I don't know what to say about this, except to say it's absolutely a trend, and I'm kind of horrified. So here's how it came up, even with a sophisticated person who was interviewing me for an organization of analysts, and they have a magazine. So he's interviewing me. And this is like the third or fourth time we've been on Zoom talking about issues. And so now we know each other and we're comfortable. And of course, he's experienced himself. And he says, well, when we get off Zoom, I'm going to take some mushrooms. And so the first thing I said is somebody in the house? Are you alone? Or how are you doing this? Well, my wife is upstairs. So, I mean, yes, these medicines are safer than a lot of the pharmaceutical medicines, because God knows if you ever read a side effects list, you'll never take the drug. But there are still percentages of harm and long-lasting harm and lifelong harm. And everybody who's been in this arena for decades knows people who have not recovered. And that's the truth, and it's not getting talked about. Okay, next slide.
Rachel, can I just
Yeah,
interject there? There's a question in the chat box from Jonathan.
Oh,
And
great.
Jonathan, if you want to unmute yourself, but his question is, as a licensed therapist, could I lose my license if I use these substances myself?
Yes, but that's not being enforced. But that's,
depending on the state.
Yeah, depending on I mean, the rules are different in different states, but in general, they're not looking for people using, in general, nobody's being arrested for their own use.
Okay.
That's just colloquial knowledge. I mean, there's no guarantee. These are illegal drugs, and federally, they're illegal.
Right.
Even in the states that approved marijuana use or psilocybin use federally, it's illegal.
So is that the case with ketamine as well? Because there are a whole lot of states where it's now seeming to be legal.
Ketamine is legal nationally. Yeah,
Okay.
federal. Yes, it's a legal drug under medical prescription.
Got it.
And
Okay.
let me add that there's a lot of professionals from ketamine clinics who are turning up in drug abuse clinics because they have such easy access to such a cheap drug, and they're overusing it and getting addicted. You can get addicted to ketamine. It is not a psychedelic. You don't get addicted to the psychedelics, but ketamine is an addictive drug.
Okay.
So there are instances of problems turning up, and it's going to increase.
And while I'm on the microphone, could you talk about some of the long-lasting or permanent side effects of some of the entheogens?
The one, well, yes. I'm trying to think of which one, which to start with. There's been decades of study on visual hallucinations. Under acid, when you move your hand, you sort of see the hand, like a film. And so some people have persisting hallucinations. I forget the exact clinical term for it. So some people have those kinds of hallucinations are visual. So some people suffer with that. Sometimes it goes away, sometimes it doesn't. What you're going to hear, the theme here is we don't know much about this. But clinically, I mean, psychologically, some people fall into, and these are DSM-5 categories: depersonalization or derealization, either of which is extremely alienating. And the people say the kind of symptoms are, I don't feel like myself, nothing feels real, everything's meaningless, there's no point in anything. And this is a real demoralizing existential problem. And I've been, somebody reached out to me who she had done mushrooms to help with PTSD, and they helped. So she did the American mistake. You heard me say it earlier in another context. She figured more is better. So she did more journeys, higher doses. And now she's had, I'm not sure I know how to I'm not a good enough diagnostician differentiate, even though they're differentiated in the DSM-5. But she's got really both depersonalization and derealization. And she's not been able to work for over 6 months. And she's from email exchanges, she feels life is pretty meaningless. And I mean, this is how people move towards suicide, one of the ways. And so this is a very serious adverse effect that can happen. And then some people have psychotic breaks or manic psychotic breaks. There's kind of a range. There's some really important research going on out of Brown University, and it's Lindahl and Britton. And I can send something to Phil about this too. I can add it to the articles he's not going to read. But they're looking at people who have psychiatric problems during meditation retreats. And it's significant enough that they've started, gee, you guys should really know about this. They have at this clinic in Brown, or the research, I'll connect you, the research division at Brown, they have a whole specialty of looking into adverse effects of meditation retreats, people who are carted off to psychiatric hospitals. And again, this is not talked about much. I met with a woman because she's an underground practitioner, but she had also worked at Spirit Rock for a decade. And she said it was frequent enough that people went from the retreat center to a psychiatric hospital in not weekend workshop retreats, but month-long or certainly 3-month-long retreats. So this is a real risk, and it's a similar risk in a similar way with entheogens. How does this, we don't know much about what the real dynamics are here. And so this woman who contacted me with depersonalization, derealization, there's no drug treatment for this. Regular psychotherapy doesn't really touch it. What's recommended is cognitive therapy, which is minimally effective. It's the best treatment is time, and then you don't know how long it's going to last. So, and they started at, when you go to Brown University, they have something called Cheetah House. That's some kind of treatment center for people suffering with these symptoms, with these diagnoses.
I just posted a link to that in the chat.
Oh, thank you. Thank you. This is really important. And they're doing training of, the same group is doing training of meditation teachers to look out for this kind of adverse effect. They're the only ones I know who are doing this.
Well, if I could follow up, Rachel, it's part of the right brain function to have a sense of no self and of no time, and kind of to lose the normal boundaries of time and space. So if people are shunted too quickly into full-on right brain experience, whether by entheogen or by meditation, I can well imagine it would produce depersonalization, derealization. In a sense, we have to integrate that with personality and three-dimensional reality in order to be functioning people as spiritual realizers. So I guess the people who take entheogens have the same problem with integration. In private practice, I've seen one guy come out of meditation retreat totally freaked out, and I worked with him for a good year or so on what he was freaked out about. And, right out of one of those deep intensives, and I've worked with people who've taken entheogens who are like, well, that was really great, but how do I live like this permanently? And so in the same way, there's sort of no bigger context, spiritual context for their realization. They don't know how to live it out. So I can see why people would end up sort of stuck in right brain or no sense of self, no sense of reality. I remember having an early experience of that myself when I was studying Immanuel Kant at Haverford in 1973. And suddenly and I had a PTSD trauma history, and suddenly I was in a dissociative state just by reading Immanuel Kant. So I can well imagine folks, taking entheogens would kind of get lost
Yes, exactly.
in a sense. So
Yeah.
I agree the dangers are great, but at the same time, a lot of my students and clients want to take entheogens and are like, gee, why don't you take some, Labman? Like, okay, but only under supervision, thank you very much. Yeah.
Yeah.
The role of the sitter then and the therapist would be to keep the person in the here and now in some ways, right? Is that what you're saying?
Not necessarily. The person is traveling. The
Okay.
person under the influence is traveling. They could be in a different world at a different time, in a different universe.
Can I just come in here because the impacts of meditation on our mental health is a different topic, and we will be exploring it in a standalone webinar in a couple of months.
Okay.
Just want to steer us back here, and Holly has her
Yes,
hand up
I
for a
can do
while.
that. Okay, but let me say one more thing, and that is Shinzen Young is the one who he talks about the evil twin of enlightenment, and that is derealization. So I'm very big on this research department at Brown because I think everything they're learning about meditation applies also to entheogens. So yes, I agree with you, and they're an enormous resource for you. Was there another question from the chat?
Yes, I have a question just quickly. Is it ethical for the shaman to be taking the medicine at the same time they are facilitating?
Thank you. In indigenous ceremonies, that is the tradition. So it's not even a question of ethics. That is absolutely the tradition. Now, the question about ethics is with Western underground use with different entheogens. I mean, I'm very big on lineage. So I think ayahuasca, for instance, which is a very, very powerful medicine, I would never take it unless with a shaman who's indigenously trained. So I would only take it within a lineage. That's my personal position. And yes, the shaman drinks. But underground practitioners who are working with MDMA or mushrooms or LSD, some of them, the rule is there has to be a sober person in the room. For some, that's the rule. Other people say, I take a tiny little bit and that helps me tune into my client. The elders are from the first school. There has to be a sober person in the room. And when I interviewed one of the elders, she gave me an example of somebody getting into so much trouble during a journey that she had to take him to the ER. Now, if she's also under the influence, you realize how much more complicated that is. Just by taking her client to the ER, she's admitting a crime. There happened to be a doctor there who was sympathetic and so did not report her. That was luck. It depends, where you are in the country and who's working. So this is a current question among underground practitioners, but certainly the indigenous practitioners, the indigenous shamans drink and are under the influence. And that's the ethic in that situation. Is there another question coming up?
Not directly. No, we can go
Okay.
ahead, Rachel. Thank you.
So this is Anne Shulgin. She's gone now. She died in her early 90s, and it was she and Sasha Shulgin. He was the chemist who invented MDMA and lots of other entheogens. And here she's working on the most important. Well, there are two levels, but this is the one level for the sitter is their own entheogen experience. And then this is the other level, is that they've done their own work. And she was very Jungian in her orientation. And so she said that they've done their own work on their own shadow. So, when I was in private practice, I would get phone calls and people would say, well, do you do this type of therapy or that type of therapy? And I always hated these phone calls. And I would say, you're asking the wrong question. Don't ask a potential therapist about what technique they're using. Ask them if they've had their own therapy. And was it a good, their own successful therapy? Don't go to a therapist who hasn't had their own therapy, and don't go to a therapist who's had a bad experience in therapy, and that's it. You want them to have worked on their own territory. So it's the same thing. If you were to go to an underground practitioner, how do you know who to go to? What questions can you ask? Ask them whether they've done what they're serving, how many times, how long they've been working, whether they have any supervision, do they have access to experts for referral, and whether they've done their own psychedelic therapy. Okay, and I could go on and on about this because this is really about countertransference. I think I have another couple of slides on this because as a retired therapist, this is, now you're getting my how my bias unfolds. This is a big deal. So the next slide. See, so I'm back on this. Jung talked about the contagion of the unconscious, especially in the setting of an entheogen, is that there's and Groff talks about this in his book on LSD psychotherapy. He talks about in a very standard analytical way, is that there's incredible merging. I mean, the client under the influence almost has extrasensory perception into the sitter's unconscious. So you have to really do your own work and be pretty clean and kind of conscious about your own inner workings, because it will be picked up. It pervades the field. And so the client can pick up anything. Okay, next slide. And so you see, this is my emphasis as a therapist, is that the guide has to be able to manage their own psyche, their own unconscious, to keep out of the client's journey. Okay, next slide. And then we should talk about inflation. I just read somewhere a new phrase which I fell in love with immediately. It was psychedelic narcissism, which is, a certain kind of narcissism prevalent in the psychedelic renaissance. So it's very important. And this is implicit in that shaman statement that I said earlier when he said, the plants want to help you. The shaman is not the medicine. The plants are the medicine. And, this is easily forgotten when someone is working underground on their own, giving people amazing experiences that people are incredibly grateful for. So inflation is a real problem around ethics and the community. Okay.
I'd like to add something if that's okay. The question about the role of the therapist versus the shaman. I love that Rachel talked about some of the overlap ethically, but I've been curious in the last few years to understand the actual lived experience of the person who's in the role of the shaman when they're serving the medicine and what they're doing. And so I've had the privilege of talking to a couple people who are friends, and they view it as the spirit of the medicine is actually working through their bodies. In fact, some of them are really humble and just say that they're just monkeys and spirits, the spirit of the plant is moving them. So that they do that, capture that humility. But everybody's work, especially, I can't speak for other medicines, but with ayahuasca, every shaman's work is different, or curandero. And in one case, just to give a quick example, the curandero, the way he works is the organization that he came up with is that once he's singing to the person, singing the Icaro, he's actually energetically going in and knocking on each of their organs. And so he may knock on their heart, and he may knock on their liver or their brain or their lungs, and He's asking the spirits if there's anything in that organ. And many times these spirits aren't ready to reveal themselves, so they'll just stay hidden. But sometimes a door will open and he'll get to see images. And so he's using the word spirits, but I would translate to trauma or our current paradigm. And so he's cleaning those spirits off of the person. And that can't necessarily be done by a therapist who's not trained in that traditional wisdom tradition. That's all I wanted to share. Thanks.
Thank you, Sunshine. Mariana, you look like you're going to speak. Would you like to?
I was really happy just seeing your face. I was taking that in. It's just wonderful to be with the ASI people again. Yeah, I have lots of thoughts and feelings about this topic. And what I really like about this presentation is I haven't heard, it's uncommon what's happening now where someone who's open to these medicines and their use is also critical and wary and discerning about it. So the point that she made that I'm most passionate about, because for a second of background in all the many years I worked in the Bay Area as a therapist to people involved in the medicine circles and the fallouts and occasionally the leaders, and this point that she made that sometimes people don't come back and that really bad things happen just doesn't get aired to the light of day. It feels like people are either trying to get the medicines legalized and they're all in the wave of promoting it, or people are more conservative about it. And what I lived with and live with inside of me is like the stories of devastation, and not just having a psychotic break, not that a psychotic break is a just, but like worse, like never coming back. Or a story very dear to me that I'm planning to share in writing is a dear friend who was a therapist and trained in all of this, and then overdosed in a medicine work context, and she was a PsyD and the whole works. So that's what is in my heart, and I'm really glad to be in a nuanced conversation about this. Yeah.
Thanks, Mariana. Alan? Can you unmute yourself there, Alan? Thanks.
Yeah, thank you. And thank you for this opportunity. I think Rachel presented some very valuable information, summary of what's going on in the underground, which I've been part of for maybe over 40 years. And one of the words she didn't use, I wish she was back.
I'm back.
Oh, okay. Well, hi. Thank you for your presentation. I just wanted to use the word preparation.
Yes.
I think a lot of the problems that are involved, particularly in the issue that you raised about informed consent, can be dealt with by having a good, serious period of preparation for the journey itself. So that questions like touch, it isn't just a question of, is it okay if I touch you during this? It's like all of the nuanced possibilities can be raised, and people also are able to get to know and trust the guide, if you will, shaman, better. The other thing, let's see if I'm blanking out on it, there was another point in your initial slide. Well, maybe it'll come back to me. I'm sorry, I can't think of it right now. But thank you again. And oh, I know what it is. It's about the question of suggestions and suggestibility. The person I worked with for quite a few years, became a close friend and mentor, was Ralph Metzner. And we used to talk about how on the spectrum of intervention, what's called intervention, where the guide interacts with or makes suggestions during the journey itself, there's a range which goes all the way from absolutely nothing, which is kind of more what I seems to look like the clinical model, and actually guiding through meditative practices and mythopoetic storytelling, the person. Now that has to be done with prior consent and with the understanding that that's going to happen. But Ralph was a master at this, and people went to these ceremonies, these group ceremonies. He's passed on now, so I can say that he used to do this work. And people had very transformative experiences and learned a great deal about ways to do spiritual practice after the medicine wears off. And that was really the goal, to not just have an experience, but learn how to have the experience. So I just wanted to add that it's a very tricky thing. Not everybody is trained to do that, for sure. And but it could be said that it's something like what the person who said that I forget who it was, but said that the shaman who does the Icaros, the targets, that's a kind of intervention. But they're trained to do that, and they're trained to do it in healthy ways, we hope. We can trust them for that. So just a bunch of different thoughts about it all. Thank you, Rachel.
Thank you.
Thank you, Alan. Rachel, back to you. Would you like us to resume the slides where you were?
Well, I think there's just one last slide, but it's really about discernment. So go to the next one. The next slide. Oh no. Well, this is the book I'm suggesting you read. Keep going. This is the question of discernment. And this is the best that I could come up with. And this is the end of the slides. But the previous speaker, I don't have your name, Alan, the nuanced questions are all about discernment. These are difficult, these are subtle questions, and this is a subtle process. And there aren't, as much as I'm saying, oh, there are rules in the underground, and there's also an enormous range of discernment that is needed. And that's what's difficult to manage in terms of ethical codes. And so this is my statement on discernment, but this is a real issue in spiritual work and the overlap with entheogenic work. So that's the end of the slides. So is there, so I don't want to interrupt the conversation anymore. Are there more questions or comments? Yeah.
Someone would like to raise a hand? I suppose from my own perspective, it's an enormous territory.
Yeah.
And whatever we do, I'm glad, Rachel, that already you're seeing some validity in the current code of ethics that we've all here signed up to. There's some validity in leaning that into the entheogen world. But there's so much more, so many traditions. Honoring indigenous practices, I think, is huge. Personally, I'm very committed to that. How do we honor the indigenous practice instead of doing what we often do in the West, which is like take what we understand and make it our own, rather than bowing deeply to that which purified and kept this tradition alive for thousands of years. And how do we hold space for that? it's like the West meets the West, you know, one thing around like the non-dual movement of the East meets the West, but this is where West meets West quite often. And how do we bridge that? I don't know. It'll be an ongoing thing, and like all things are, you know, whatever we do come up with as the code of ethics will be an evolving code as we move further into this and gain more experience as we go along. It has to be changing as we go, as we learn and grow, you know.
I can say one thing about the indigenous situation, and that is, you know, there are a lot of retreat centers in Peru and Costa Rica, and they're commercial retreat centers, and they hire indigenous shamans. And the question is, how do they treat those shamans? So they're employees, and generally they're given X amount of time to sing, for instance, especially the Shipipo shamans who sing individually. You can sing 5 minutes to each client in the group. Well, that's not how the shamans actually work when they're doing their own ceremonies. They're not time limited. So there are all kinds of, you know, we as a culture, we have to learn about asking the right questions before we sign up for something. And just how many people are in the group?
Yeah. Thank you, Rachel. Everything you say has value. It's informing all of this. Keep talking.
But I guess I talk about
sorry,
the things
can I
that
just-
upset me the most.
I have a
Sorry.
question for Rachel.
And someone else was talking too.
Oh, let them go first.
Sunshine.
Sorry, guys, there may be a delay. I just wanted to thank you, Jack, because your comment is something that's near and dear to my heart, the appropriation. And I think I lean on that end of the spectrum on this topic, but I also have had a lot of conversations with those working with this medicine down in South America from indigenous communities outside of Shipibo Canibo, which is one tribe that's been getting the most attention in the last 20 or 30 years because of they're just amazing. But they're Rachel, you probably know better than I do, but 23 tribes that work with ayahuasca in the Amazon. And then of course it moved into Brazil and took on a totally different practice because there's no shaman that, you know, uses it in Brazil. It's more of like a church-like setting. But
Christian church.
yeah, but there's not really consensus down there either. It's not like there's one way to work with it. And so I think they're gracious when it comes to making sure that the integrity is there, that the risks are managed, you know, that the dosing is right, etc. So yeah, I think there's some flexibility there.
Rachel, I'm curious about what you indicated was a kind of that there are two worlds in which entheogens are being used in a spiritual context and in a therapeutic context. In your experience, is there any integration, or to what extent are the people doing therapeutic work spiritually informed and vice versa?
That you get the whole range. There's no
Mm.
And so I don't mean to say there are two worlds, because there are many, because there's also the entrepreneurial world, the corporate world, the profit making. Let's not forget them. So there's the underground, there's the indigenous, there's the medical research.
Kelly, would you like to unmute yourself?
Yes, I had a question about how, Rachel, you feel the word embodiment, because I know that philosophy, you know, the ethics kind of track is very heady and intellectual. And then there's this spiritual context. And, you know, when you're embodied, do you feel like when you're altered, you can't really trust your body to be the guiding, right or wrong kind of action, what you should do, what you shouldn't do? Or can you still rely on embodied sense of ethics, even in an altered state?
Everything's different in an altered state. Everything. So, and that depends on how well how expert you are at navigating your own internal proprioceptive cues, and it's all different. And it's changed under the influence. So people have a hard time with that. I mean, when you read reports of someone who's been abused by shaman in an indigenous setting in South America, God knows what mixture of drugs they were under, because some of it can be some of it can be a narcotic drug that was mixed in. And then they just lose their own sense of internal knowing. These are really difficult territories.
Rachel, is there resistance in the therapeutic community to codes of ethics and ethical standards, enforceable ones?
In the therapeutic, in the professional,
Either way.
There's a lot of controversy. So some of it, some would call resistance. It's like the Wild West. I mean, it's just, the range is just enormous. So, some people don't want to limit the right to use these medicines to the medical or to the licensed therapist. And there was, in my home state is Maine, and there was a group wanting to meet how to monitor some of the underground practitioners, because there were some problems there. And trust me, there are problems everywhere. But I thought, how are you going to monitor what is already illegal activity? There's no way to, I mean, as a psychologist, I have, I can be held accountable by my licensing board. But if you're already in illegal activity, there's nobody who can hold you accountable. So as a group, I admire your venturing into this world. And it's a very complicated, difficult to manage territory with such enormous potential and some disastrous issues. And so as I think back over the presentation I made, I have to say, just again, that my bias is as a therapist. And so I'm concerned about the therapy issues. But there are much bigger issues present, as you can see, and I have no clue about how to handle the bigger issues. So I admire your moving into this territory. And I was just in an email exchange with a friend of mine who's present here also, or at least was. And I reminded her years ago, she said to me that the public needs to know what questions, the public needs to be educated, that's the best, safest, the best approach to increasing safety is for the public to know what to ask, how to make an informed decision. And so I think there could be progress around the public being better informed, so the public can know what's better, what's safe, and what isn't. Whether they abide by that or not is their decision, but at least there could be guidelines for the public to know what to ask.
I've heard the idea that drug education as it exists in schools
Oh, please.
shouldn't be so much, I know, shouldn't be anything like what it is, but rather educating along the lines you're talking about. Like, what is the nature of these substances? How have they been used positively, negatively? What are possible abuses? You know, just like sex education. I think they make an effort at that in schools, which might not.
Yeah, just it's another disaster. But look, aren't you the one who introduced you are, Alan. You introduced yourself and said then the decades you've been working in these realms. Well, that's an important bit of information for someone to know.
Yeah.
So, and that's
It's
one
on
of
my resume.
Yes, I'm sure it is. On your IRS return. But someone should know to ask that question.
Right. I'm not saying I want to be careful here. I'm only saying I've participated and observed.
But how many years have you been working with these medicines? Who was your mentor? How long did you work with that mentor? I mean, these are the kinds of questions. There could be real concrete guidelines for people making decisions.
Right. And
Something's happening with your mic, Alan. We can't hear your voice. It's breaking up.
had my hand over the mic. Is he hearing me now? Yeah. It's an incredibly complicated field, and it always will be. I think just like spiritual teachers, we've had seminars where we talked about the abuses and mishigas that goes on with spiritual teachers in terms of sex and money and power and all of that, and it exists in psychotherapists. Among psychotherapists, I don't know if the percentage is any higher of abuse among psychedelic underground guides or not than in any of these other areas. But I think it has tremendous promise. I really do. I just want to put that out there, at least, that it can help people in many, many ways, including in terms of their spiritual awakening and transformation. That's at least my opinion based on my experience. Would you agree with that, Rachel?
Oh, absolutely.
Yeah.
Everything.
Okay.
Haley, I see you've posted something there in the chat box. It's for Rachel. What's your personal or working definition of safe/safety?
Oh, God. That's a boy. You had to ask that, huh? I mean, clinically, I would say is that there are very, very limited adverse effects. I want to know that I'm going to come out of this better than I went into it, and that people are informed about the risks. And nothing is 100%, but I'd like to be informed, and I'd like the risk to be minimized. What makes this so difficult is all the personal stuff in the people in the practicing in this arena. And that's since there's no way to regulate them, really, it's the same thing you face with gurus or spiritual teachers. There's no regulation, or they could be self-appointed. It's very similar.
Rachel, speaking about risks, I, I know from talking to people who do research that in that realm, there have always been categories of people for whom the use of the medicines are counterindicated, or
Yeah.
who are considered too risky to accept into a protocol. Do underground practitioners also have such standards, and what are they? Who's at risk more than others? Sorry, you're shaking your head.
Well, remember I said I spoke to this one underground practitioner and I asked her about medical screening and she said, "What's that?" So that gives you a range. One of the most important is if someone's on an SSRI and one of the antidepressants, there's a risk of serotonin, I forget what it's called, but an overload of serotonin, which is potentially very dangerous. So they should not be given a psychedelic. So they need to be screened out or given a couple months to come off of that med. But that's for the psychedelics. That doesn't necessarily, it certainly doesn't apply to ketamine. People can remain on their SSRI and do ketamine. That's a different combo. So there's specific combinations and many of the underground people, this is why they consult with a pharmacologist, because this is also complicated. But that's the most, it's serotonin syndrome is the name of it, and people get very sick. It's very risky. So, and I don't certainly know all the medications that are contraindicated, but ibogaine is a risk for heart issues. That's one of the more difficult medicines to take. So it's very complicated here again. But one of the things I say is don't go to a ceremony where nobody's asked you about your health and your medications. Don't go. And then the experienced practitioners know that people lie about what medicines they're on. So you see how complicated it is from both sides.
Rachel, we're close to the end of our time. Is there anything you want to add or anything you want to say that you haven't?
Well, I can't speak for Dana, but I certainly miss him. And he would have, as a professor, and his recent book is on the perennial philosophy, he would have a whole different perspective, not so biased in a therapeutic kind of way. And he would have a more spiritual perspective on this in a broader context. And so I just want to acknowledge that I miss his presence, and I'm sorry you're not benefiting from his perspective.
Jack, you want to close us out?
I just want to say thank you for everybody who contributes in their presence and in their conversation and thoughts and ideas and chat box entries to this community, because it is a community and we thrive in community. And thank you to Rachel, who's like, you've turned my head 360 a few times in the last 90 minutes. And I knew it was kind of taking on a mountain to attempt a code of ethics for this sector, and now it feels like a mountain range, but we're going to do it anyway and see what we can learn from it and what we can offer, and let's just do it anyway.
But I just want to respond to your use of community, because that's really what Dana talked about. That's the opposite of the individualization that therapy is so much about. And the indigenous is, what do you bring back to the community? So thank you for mentioning your own community.
So thank you, everybody, and we'll see you in 6 weeks' time when we have another one of these. The recording, I'm just aware, because of the underground or illegal nature of this work, does anybody in the ASI know what we are doing about this, so that we either have consent, or do we post it, or what do we do? I'm just a little bit wanting to be cautious here.
What's
You'll
your
have to
question?
consult the legal department at ASI.
I don't think anybody said anything that would involve them being prosecuted,
Okay. All right, then please email us.
including me.
Yes, yes, it was you I was concerned about, Helen, actually. It's like, yeah. Okay, so thank you, everybody. Catch you downriver. Thank you.
Thanks, Rachel.
Thank you.
Bye-bye, everybody.